A pelvic floor muscle examination only lasts 10 minutes, but honestly, it can add years to your life. Oftentimes, providers are not doing this essential examination that is the first line of defense against cancers that affect your vulva, vagina, cervix, uterus, bladder, fallopian tubes, ovaries, and rectum. So watch this video to make sure that you are not missing out on a critical step of your medical care. Hi, my name's Dr. Laura, and on this channel, I help you gain optimal health through knowledge and movement. I know many of you have probably had a pelvic exam and think you already know everything that you received and you're thinking that's good enough. But believe you me, I have been in my fair share of pelvic exams where providers have skipped essential steps of the examination, which means they're leaving me open to not getting my proper screening. So the first thing you can expect as part of your pelvic examination is assessment of your external genitalia or vulva. Remember, I'll be using terms that are gender neutral, but also just friendly to everyone, as well as the anatomical terms. So when we're looking at the external genitalia or vulva, we're looking for any skin abnormalities. Some of these abnormalities can look like skin changes, such as redness, discoloration. Sometimes things look extremely pale. Also molds, bumps, or any swelling. This can oftentimes lead the provider to think that there might be vulvar cancer that is occurring. Next, they move into the internal aspect of the exam. This is where they pull out that speculum. It can be plastic or metal, and a lot of times people associate it with discomfort and even pain. The purpose of the speculum is to push the tissues and the muscles out of the way to give your provider a good view of the vaginal canal and the cervix. Here, they are screening for any vaginal or cervical cancer. So again, they're looking for any tissue changes, abnormal discharge, nodules, or lumps. You can also expect them to perform a Pap test or Pap smear. This is where they take something that looks kind of like a spatula or even a cone-shaped brush, and they actually place it partially into that cervix so that they can collect cells and look at them under a microscope to see if there are any abnormalities. The cool thing about this test is that it is the first line of defense against cervical cancer. If you have already learned a lot from this video, make sure you go ahead and give it a thumbs up. Also, hit that bell notification when you're over there so that you're aware of when new videos drop. And when you get time, make sure you share it with a friend so that they can avoid cancer as well. The provider will then remove the speculum and move to the next part of the examination, known as the bimanual examination. Bimanual simply means they are using two hands. So with a gloved hand, they're going to go ahead and put lubricant on their two fingers. They're going to place those two fingers inside the vaginal or middle opening canal, and they're going to take the other hand and place it on your abdomen. They're squishing or pressing these two hands together so that they can feel and appreciate the bladder, fallopian tubes, uterus, and ovaries. From here, they're really going to look to see if there's any pain, if there are any abnormal growths, assess the size, shape, and feel of all of those important structures. They then will remove their hand from your tummy and the internal fingers, and then they're going to place one lubricated finger inside the rectum. Again, they're assessing for those lumps, bumps, and nodules. It is really important to make sure that you are getting all of these parts of the examination. Personally, as I said, I've had providers skip many of these parts. Oftentimes, the rectal assessment and even the bimanual examination has been something that's been skipped for me. I've even had providers try to talk me out of even having a pelvic exam, and that is just wild because all of my other indications were 100% telling me I needed that exam. Now, if you are like me and get a little bit nervous for pelvic floor examinations, don't worry, I have you covered. In the screen next to me, I have an amazing video that covers a great guided meditation that I created. I can't tell you how many of my clients have listened to this while they have gotten their own pelvic exams, and it's allowed them to not have that discomfort or nerves that they typically experience. So I'll see you over there.